nuclear or gamma radiation and have always thought of it as cool, yet mysterious and dangerous. What about it is so dangerous? Why is everyone so terrified of radioactivity and wants to get away from it? The answer is that it has a devastating effect upon the individual cells of the body. What if we could take this negative effect but use it for good? One way this is being done is in nuclear medicine, specifically bone scintigraphy. I will discuss some key points and address a few general questions about it. What is bone scintigraphy? Bone scintigraphy is the process of injecting an IV in a patient with a radionucleotide bound to members of the phosphate family. The radiologic substance travels through the body and gets absorbed into the bones and surrounding soft tissues. In areas of abnormality, this substance accumulates in greater concentrations. Thus, these hotspots appear much brighter on the image. It is important to realize, however, nuclear bone scan is not used necessarily as a diagnosis. It is more concerned with ruling out conditions or disorders. This is because, while bone scintigraphy can highlight a problem, generally these problems appear on the same image. The only indication anything is wrong is a brighter fluorescence of the area affected. What are some of the conditions and disorders this medical science will help to discover? Possibly one of the most important uses is the detection of bone cancer, sometimes months before the mass shows up on a regular X-ray or CT scan. Obviously, the sooner the cancer has been found and diagnosed, the better. Not only does it help to detect cancer, but nuclear bone scan can help identify if the cancer is in remission or if it is spreading. Another important disease it detects is Paget's disease. This disease affects the growth of new bone tissue. The result is a much weaker and fragile skeletal system. Even things as simple as fractures may be located by using bone scanning. This is especially true if the fracture is too small to be observed on a regular X-ray. Other conditions and diseases discovered include arthritis, fibrous dysplasia, and avascular necrosis, among other things. What is the procedure like? The procedure is virtually painless. Upon entering, you will be given an IV and injected with a radiologic substance. Your technologist will instruct you to begin drinking fluids to help the circulation process. After a few hours, you will be ready. You will need to relax on the table. An arm wrap will be applied to support your arms. You will then slowly be slid into the chamber where the camera will begin to photograph your body. And photographic imaging does take some time, as an hour or more is not uncommon. Once the images have been taken, you are free to resume all normal activities. You may be instructed to drink extra water to help flush the radiologic substance from your system. Overall, this is a very useful and important tool for doctors to use in the ever-changing field of healthcare.